So this is our vaccine room. This is where we keep all our vaccines when they come in. We have 4 pieces of equipment. One is an ultra cold freezer, a regular freezer, 2 refrigerators. We have mobile refrigerators and freezers that we use when we deploy off-site, as well as small blue coolers when we go to smaller clinics. So right now we're currently storing our regular adult and children vaccines in these refrigerators, but at one time during the early pandemic, each refrigerator had full COVID vaccines in it. So we would use one refrigerator for Pfizer, the other refrigerator for Moderna, our freezer, and our deep freeze. So when we found out that a vaccine was developed, I mean, for me, it was like the greatest news. And I think for us, we had to flip from the motor vehicle site because I think they were going back to work. So we were like, okay, now what are we going to do? We don't have this great site. So we were fortunate enough to get the parking lot here at Erickson, which was, out in the open. So we set up tents and drive-throughs. So basically we just flipped our testing plan. Instead of doing a saliva test, you're going to just do a vaccine. I mean, it sounds simple, but it was a lot of logistics went into it. And so we just started doing vaccination here as soon as we got it. Same thing, back then, people were like hijacking trucks, stealing vaccine. And, so we had to work really close, thank God, with our sheriff's department, who were invaluable throughout this. And they would pick up our vaccine from our secured site and deliver it to here at Erickson, and then we would do that back and forth. I mean, did thousands. I think 1,200 was our most in a couple hours here at the drive-through. So it was easy. It kept our staff safe. The residents just rolled down their car window, and we just gave them the shot. So for us, it was a game changer. It really was.
And related to when a vaccine came out, we know from history and from what we do in public health that vaccines save lives, okay? Vaccine prevents disease. That's why people go and get a flu vaccine, if they believe in it. There are people who don't believe in it too, okay? However, we do know that statistically speaking, that vaccines improve our quality of life. It prevents us from getting disease. So this is what we needed to do. We also have to remember that when the vaccine came out, logistically, we had to figure out how we're going to sign these people up. We had to determine, because you still have to consent to getting a vaccine, so all these people had to consent to it. So we had to come up with how do we do that. And we worked with our IT office to come up with something in the interim very quick. We had actually already been using it for the testing purposes, so we turnkeyed it into vaccine. But then we had to look at the larger picture. We're going to be giving out a lot of vaccines over a period of time. Right after Christmas holiday, when we're going to start doing vaccines, I can remember being on a call. Are we going to wait for the state program to come out, or are we going to do our own thing? That was like a Sunday call, again, between IT, the county administrator, myself, and it was like, we're doing our own. If the state comes out and we use it, we'll use it, but we can't rely on other things. We got to move forward. So we had these kinds of conversations, and then the other thing was, it was a limited supply situation. And that's one of those things. We've been through a flu in previous years, okay, that there's a limited supply of vaccine for whatever particular reason. So with that being said, this was limited supply. We only got so much. I mean, we advocated and we advocated. We advocated for our hospitals because hospitals were giving vaccine. We were giving vaccine. The state was setting up centers. So the one thing that we had to do as a team, as a county team, is that we had to look at how are we going to give these vaccines. Everybody wants one now. In the beginning, they were I'm not so sure about this. But then it became that everybody wanted a vaccine.
And in the beginning, when the vaccine came out, I remember, of course, we gave it to our staff first because we can't have them giving it not if they wanted it. But then we had to make sure we gave 6 nurses the shot first and then wait, because if God forbid people had reactions, because nobody knew, then now I'm out all my staff. So we had to stagger them. And then I remember too, early on, like Les said, it was rationed. So not the general public couldn't just come in and get it. And you'd have a line of 500 people, and they'd come up to you and they're begging you and crying, please, my so-and-so is in the car, I need this shot. And we're like, we only have 3 left. And then it was like, you also didn't want to waste it. So we had to, once you opened up the vial, you had to use that. So it was like at the end of the clinic, you'd be like, okay, who wants it? Is that person still in the car? Or can you call your grandmother? Can come? So you didn't want to waste vaccine. So it was so much coordination and management. But the hardest was, having the people just like, begging you. And we had to follow what we were, tasked with. But
we did. We had to turn people away.
Had to turn them away.
We had to turn people away. And, even when vaccine started, we were in winter here.
Yep.
We had people coming to different locations. So we had locations in East Brunswick and Monroe. We had Sayreville. We had New Brunswick, and then Port Amboy, I think, were our locations, and here in Piscataway. And, and we didn't have a really rough winter, but we had some winter weather on days when we were doing these vaccinations. So I can remember being down at the Monroe Senior Center, and it's snowing out. Yeah. It's snowing, it's freezing rain, and here are these people that were in their 80s and 90s that are standing out there in the cold, and they're like, can't you go faster? Can't you do this? And I mean, you feel sorry for these people. But, our staff in public safety, our sheriff's officers and everything was always on the move as it happened. So it would be like, look, folks, go sit in your car. If you're on the list for today, you're getting a vaccination. Don't be afraid you're not getting it. You're going to get your vaccination today as long as you signed up. Go to your car. We know you're in this section. We'll call this section up. There's no reason for you to be standing out in these elements. So we had to adapt to that. When we were in East Brunswick, we did get a big snowstorm, as a matter of fact, and we had to make sure, it's a nice facility, but we were also limited by how traffic could come in and out and how people could park. And we were all over the place, and it took a team of people from the municipality to clear that snow so that we could park cars. And we were having upwards of 1,000 people coming that day, in and out over that period of time of like 4 or 5, 6 hours. So it in that respect, it was an undertaking. It wasn't just us there being ready to give the vaccines and have the people there to administer the vaccines, and you also had to wait.
Yeah, the waiting added an extra element to it, because if you got your flu shot, you just got your flu shot and you went home. But this, we had to monitor them for 15 minutes, so we had to set up a whole area, distance, so you couldn't put a lot of people in a room. It had to be open space. So you had to have medical personnel in there. We had to have EMTs on standby. And thank God we really didn't have any bad reactions. But that was a whole new thing for us in nursing, because usually you just send people on their way. So you had that element.
So I think for me, the time when the tide turned as to we were going to get through this was probably when we got about through half of the priority groups of vaccination. We hit the most needy. We took care of our first responders, and then we started taking care of some of our public, and we were doing it. We were getting it done. As more people were allowed to, we were vaccinating. Our hospitals were vaccinating people. They were out in the community vaccinating people. Our pharmacies were vaccinating people. We were able to get additional resources or hire additional resources that did that. That's when the tide turned. We had staff to do it. We had more people doing it. You could go anywhere just about to get a vaccine if you wanted to. So that's kind of, I think, at the point when the tide turned for me that, we will get through this.
I think for me, it was when we found out that there was a vaccine, because we all know, it's the greatest public health, thing in the world. But for me, it was, thank God we have a vaccine coming. And I guess probably midway, July or that summer of 2021, I kind of felt like we got this and things are going to change. And then of course we had the variant. And then we kind of fell back a little bit. And of course the worst weeks were, leading up to Christmas of that year. And but we already had things in place. We knew how to do testing, and we got the service, and we did 1,000 tests a day, rapids. And by then, rapid was developed. You didn't have to wait 3 days. So I think as we got smarter and learned more about the disease, things changed. So we had the rapid test, and we were able to just, adjust and okay, we got this. But for me, it's definitely when, I was so excited when I could get a vaccine. I actually think I was the first person to get the vaccine in the department, and I still have the vial. But I was so happy, but so scared, because I'm like, I don't know what is this mRNA, But that was, for me, that was the turning point.